Hi YouTube! I want to give you guys a quick Ignite talk about the childhood obesity epidemic. I'll focus mainly on children in Canada, although I will reference a study from the UK. Specifically, I want to talk to you guys about the obesity prevalence in children, what they're eating, and how much energy they're expending. I'll then bring it all together and talk about some things that we can do as a society to help them out. So what is obesity exactly? It's defined as having a body mass index of over 30. Here you see a child's BMI chart where the orange boxes are considered obese and green is considered normal, where your BMI is between 18 and 25. Some consequences of being obese are being at a higher risk of developing type 2 diabetes, high blood pressure, and high low-density lipoprotein cholesterol, which is the bad kind. These can all lead to an increased risk of cardiovascular disease, especially when coupled with sedentary lifestyle. And it should be scary to you that cardiovascular disease is the second leading cause of death in Canada, following cancer. The International Journal of Obesity has found that obesity has doubled among children since 1926. This table represents data from Statistics Canada in 2013 and shows that nearly 20% of children aged 5 to 17 are overweight, and nearly 20% of them aged 12 to 17 are obese. So why is 1 in 5 children in Canada obese? Overall, our diet nowadays is lacking vital nutrients, and our sedentary lifestyles of office jobs and screen time is having an impact on our kids. They see it and they think it's okay, so they do it too. The study done in the UK, published in Nutrition and Food Science, found that children are lacking fruits and vegetables, fiber, and oily fish. We need around 400 grams of fruits and vegetables per day, but they found that those aged 15 to 18 were only getting 200 grams a day, and if you were younger, it was less. Along with not eating enough fruits and vegetables, they aren't getting enough essential fats. Only 5% of what was actually needed for oily fish was actually consumed. But most importantly, nearly 1/3 of these calories in their diet came from junk food. Junk foods today are so processed that they are so easy to prepare with very little, or if any, effort. They are prepackaged and contain many ingredients like white flour or enriched wheat flour, high fructose corn syrup, other sweeteners, MSG, and preservatives. High fructose corn syrup is a sweetener alternative to sucrose or common table sugar. It comes from corn, which is dependable and renewable, and it's really cheap to produce, so it's easily seen as an alternative. Although it's not the healthiest, many journals are split 50-50 about its role in obesity. A study published in the Canadian Journal of Dietetic Practice and Research found that the portion of Canadians' grocery budget spent on ready-to-consume foods has risen by nearly 20% since 1953. And it's not just the poor eating habits, it's the combination of eating poorly with an increased sedentary lifestyle that's making our children more susceptible to obesity. The Canadian Sedentary Behavior Guidelines recommend no more than 2 hours per day for a child aged 5 to 11 years, and lower levels of being sedentary are associated with additional health benefits. Both the CDC and the World Health Organization both recommend at least 150 minutes of vigorous physical activity per week. For children, they can do after-school sports that are competitive, so practices and games can count towards this. So putting it all together, the combination of added sugars and simple carbs with no means of burning it off makes your body think that you're in storage mode, so it converts the sugars and carbs directly to stored fat. This fat adds up over time, which means you gain weight and eventually becomes too much to handle. This was a quote I found from a CBC article stating that Stats Canada found that nearly 31% of children are overweight or obese. They say in this article that the medical community has to work hand in hand with parents, with the food industry, and government regulators to figure out what's best for the best way to reduce this obesogenic environment that their kids are growing up in. We can show children how to be physically active. It just takes setting an example for them to want to be involved in that lifestyle. And as Dr. Mark Tremblay said, we have to work hand in hand with the parents. If children grow up eating healthy with parents who emphasize getting fruit and vegetables from when we're very young, the children will grow up with the same foundation on how to eat properly. In turn, this can all add up to living a long, healthy life. Thank you for listening, and I hope you enjoyed my chat. The references I used are listed in the description.